have a casualty?
There's a term military doctors use after a soldier receives a serious injury. It's called the golden hour.
You really have an hour to really fix a lot of these things, and if you can do as much as you can in the field, you can save a lot of people.
Military experts concluded that 80% of combat fatalities might have been prevented if bleeding could have been stopped. Progress has been made in that area.
We've developed bandages with clotting factors on them to put on the wounds, which were big advances.
My thumb is on the red. Push it open.
Training provided in a Stop the Bleed class teaches students how to apply a tourniquet in just seconds.
So there's the regular method where it takes about 30 seconds to put on a tourniquet. I'm going to show you how to do it within 10 to 12 seconds.
Quick action has saved lives on the battlefield and in civilian life.
I swing the tail end around.
With burns, survival rates have improved drastically. At one point, the percentage of people expected to live after a serious burn was 50%.
Well, now in the United States, that's 80%. It's 80, almost 90% in some cases. And so we have gotten a lot better with the critical care and the management and the wound closure of people with big burns, particularly in the military.
Another major advance is that trauma care was moved up to the front line, so treatment could be given almost immediately.
So we saw individuals that were much more severely injured than in the past. So they were surviving and getting to rehab and having multiple trauma, or what we called polytrauma. So head injuries, burns, amputations, fractures, the list would go on. And so the care was much more complex.
The complex nature of that care meant military doctors had to work in teams.
Even the rehabilitation teams would expanded beyond the traditional therapists and rehab doctors to include the plastic surgeons, neurosurgeons, infectious disease doctors, all working as this huge team to kind of meet the needs of each individual veteran or service member that was going through rehabilitation.
There have also been advances in prosthetics.
Prosthetic hands used to just be either a hook or they could just open and close, and they'd have one degree of freedom, one thing they can control.
The goal now is to make these prosthetics act as much like the limb that was lost, including the ability to feel. At the Cleveland Clinic, a doctor has developed a prosthetic arm that contains a highly sophisticated computer that communicates the sense of touch with the wearer's brain.
They feel as though their hands are moving even though they don't have a hand, and they feel as though their fingers are touching things even though they don't have fingers. And the interesting thing about it is that when we put all of these systems together, their brains actually feel like the hand is human.
There's a long way to go in helping the injured return to civilian life with better prosthetics and burn treatment and good brain function.
Ready and go.
But the doctors who spoke to VOA say medical advances in their fields have come a long way in the past 20 years. Carol Pearson, VOA News, Washington.